You being doctor, do you believe in spirituality?
Whole day मैले राम्रो काम गरेर if I can go back to sleep with a content, that is spirituality for me.
And भगवान छ विश्वास लाग्छ?
I do.
How would you or why would you believe that?
विश्वास लाग्छ because in the end of the day there is karma.
हजुरलाई लाइफको कुनै यस्तो मोमेन्ट छ जहाँ चाहिँ where you really prayed to God?
I've lost my brother, I've lost my parents. These are the times when praying gives you so much strength.
Especially अहिलेको नयाँ पिढीको डक्टरहरू त they are all about money. सुरुमा चाहिँ त्यो पर्सु भनेर जाँदाखेरि सबैको सेवा भावना नै हुँदो रहेछ.
इन्भेस्टमेन्ट पनि ह्युज छ.
मोडर्न मेडिसिन पढेको डक्टरले आयुर्वेदिकलाई मान्दैन भने.
So RCTs भने चाहिँ करोडौँ अरबौँ मान्छेमा गरेर yes औषधि no औषधि एटेन गरेर so there are different clinical trials गरेर it comes into the market. तर अब आयुर्वेदिकमा there still has a lot of research to be done.
एउटाले निको हुने अर्कोले नहुने. हैन तपाईले त्यति नै माया गरेर दुईजनालाई गरेछ भने भनेपछि यो कर्मसँग रिलेटेड छैन होला है.
It all depends upon the experience and the molecules because it's a subject which is evolving.
स्किन मात्रै हेरेर पार्टनर चुज गर्ने बिहे गर्ने मान्छेहरु धोका खान्छ नि.
If you're not liking what is there in the packaging, you're not going to buy it. Everything is, it has to be beautiful in a package.
Like it's such a wonderful thing. I mean, doctor and spiritual, like I mean, these are two. Just मेरो engineering र spirituality on there is science and spirituality कुरा हुन्छ नि. So I mean, doctor is the same thing, less technical, but then more biological. You're a doctor भन्नलाई के गर्नुपर्छ? Can you maybe explain? मान्छेले बुझोस्.
So doctor भन्नलाई it's a long tedious process भनौँ न. Like I can talk for myself. अब 10 class पछि I did my +2 and then +2 पछि चाहिँ I competed. So I got a scholarship to study in Calcutta. त्यो बेलामा it was like whole Nepalमा there was only 2 seats.
यो चाहिँ MBBS को लागि.
MBBS को लागि. So 2 seats for Calcutta from Nepal.
कतिजनाले अप्लाई गर्छ?
अब I don't know, हैन? So
roughly कतिजनाले?
अब like
को लागि कतिजनाले फाइट गर्छ?
त्यो बेलामा maybe people wanted to become less होला अहिले जस्तो त्यस्तो छैन but
कति
tentative I can't say but 1000 and 5000 something त होला. And then they go to
हजारौंको संख्यामा आएकोबाट जम्मा दुईजना
छ.
That's not even 1%.
Yeah, so that is for Calcutta no? And then Nepalma there was only teaching hospital, the private hospital was not open that time, हैन? So this was way back in 1992.
Okay.
So that was I think only teaching hospital was there. So त्यसरी गयो. Then I was the only foreign student among 150 Indian students भनौँ न. So Bengalis and non-Bengalis were a certain percentage and I was the only Nepali student or only foreign student. So I would be picked up by all the teachers. त्यो गोरो केटी, where is she? So it was very difficult for me to it was very difficult for me to not go for class because they would every teacher would mark me. So त्यो भएकोले it was not that I wouldn't go. त्यसमा त्यस्तो छँदै छैन but still they would, as soon as the teacher would enter or start taking our roll calls, they would ask, where is the phasa? It's called the...
Sabina khoi.
Yeah. Naam maybe, but it's that phasa Nepali me. So phasa Nepali me is phasa means the white, the fair. So Nepali is from Nepal, and me is the... Nepali. Everyone would ask. So that was how I was recognized in the college. So 4 years of MBBS and it was so difficult. Passing percentage, and passing percentage, and because we had 3 professional exams, and the exams we would not be allowed to take in our own college. We would have to go to a different college. So the examiner panel, the external would be someone new, and your own teacher who has taught you would not be there for you. So it's a completely different environment where you go to give the exam. And for medical exam for Calcutta University, the pass percentage was less than 40.
Okay.
So they had to get the best doctors out. So after the first professional, second professional.
60% मान्छेहरु चाहिँ फेल.
Would not.
Wow, you have to come in top 40.
Yeah, and then Calcutta Medical College say Bengal ko only to medical license your entrance exam ko topmost cream out okay? And Bengalis padne bhane ta it's like the time when I was sleeping they would read. When I'm like when I just got up they would still be immersed in their books. They would mug up so they would come mug up comma full stop everything book eti moto bhavan they would know everything by heart so it was a tough competition then 4 years पछि चाहिँ then there's internship. So 5.5, then त्यसपछि you come back and then you have हाम्रो पालीमा चाहिँ 2 years of work experience. Then you go to the PG. So post-graduation, let's say you choose your subject, what you want to study or what you want to do later. Yeah, specialization. So this is again another 3 years of rigorous training. So you would forget what food is, you would forget what rest is. Then after that, then you have you have another exam. After the final exam is over, you have another exam to pass for the licensing exam. So this like license exam. Even if you pass the final exam, even if you become a specialist, you still have to pass the national licensing exam. त्यसपछि then you become a specialist. त्यसपछि भन्न मेरो subjectमा there's no DM. Otherwise, other subjectमा there's another DM, which is another 3 years of super specialization. Suppose if you talk about internal medicine, you do DM in different systems, say respi, gastro, cardiac, so in every organ, then you become a super specialist, so only one organ.
There is like a fellowship.
Yes, a fellowship is 1 year when you want to choose sub-subjects. Like in my field, the different aesthetic dermatology, there's pediatric dermatology, so many different subdivisions as where you can do fellowship. But Bhanna, we don't have that 3 years of thesis writing and super specialization. After that, then you come to the ground to actually as an individual consultant. Otherwise, you're always shadowed by some senior because it's a training process for them. So it's a long process and you have to read I don't know how much.
यो त तपाईले भन्नुको अहिलेसम्म मैले तपाईबाट सुनेको चाहिँ यो मेहनतको मात्रै भयो त्यसमा लाग्ने पैसा
Because I was fortunate enough to have completed my master's and my post-graduation and my MBBS scholarship.
So you're a brilliant person.
So, but still it was very less that I had to pay. Otherwise, for MBBS, if you have to compete and then get your name out now, entrance exam, but it's about 40,000-50,000 tuition fee. Then you have your living cost. You have so many other eating costs more. Then post-graduation would be another 20-30 lakhs. So it's a crore investment to just be a specialist.
Sure.
So a lot of
अनि त्यत्रो मेहनत अनि त्यसमा फेल भयो भने
then you have to pay for the exams again.
हैन अनि त्यसपछि पास भइसकेपछि then you come to hospital. Fee कति हुन्छ?
So per person depending upon your experience 500 रुपैयाँ.
Average 500 राखौँ. एक पेशेन्टबाट 500 रुपैयाँ कमाएको डाक्टरले 40-50 लाखको compensation एउटा मान्छेलाई पर्यो भने त अनि के डाक्टर पढ्नु त अनि
That is the stark reality.
है सो भनेपछि मान्छेले पनि बुझ्नु पर्यो र साँच्चै पनि हैन अब सम्बन्धित निकायले चाहिँ यस्तो सिस्टम बनाउनु पर्यो कि राम्रो नराम्रो छुट्याइदिने
एकदम
हैन हुन त तपाईले त्यो लाइसेन्स पाउने भनेकै यो राम्रो मान्छे हो है भनेर त्यो राज्यले चाहिँ हैन तपाईलाई अप्रुभ गर्नको लागि बनाएको छ
competition even to get the license to study
अनि यो त तपाईको thankless job भएन र यो मतलब मान्छेहरु मतलब निको भयो भने चाहिँ डाक्टर राम्रो भयो निको भएन भने बेकारको डाक्टर छैनस् यो कस्तो प्रोफेसन चुज गर्नुभयो तपाईले
No, but it's not always so. There's so many gratifying moments and people actually thank you. People actually get you gifts. There are occasions when my OPD is full of gifts, of people showing gratitude, people feeling good about themselves.
That's very rewarding.
Yeah, so that for me is more rewarding than, the 500 rupiah is, it's a thing, it has to be there for you as a doctor to see patient.
मलाई जस्तो लाग्छ अधिकांश डाक्टरहरु चाहिँ सेवा गर्छु भन्ने पर्छ है. Few are, I think only few are like money mongers.
Yes. And I do social service as well. After my HOT, I give back. We have an organization called Ek Ek Paila where we go to the remotest areas.
Ek Paila.
So remotest area twice a year to give back, to, serve patients. And
free.
For free. It's a voluntary job, So this must say, we go to places where they don't even know doctors exist, let alone different specialty. We have it's been a long lot of places. I was just counting the jillas that I went, So it's more than 50 Mati. When you see the Nepalco map, the Matiko. So we so I was just counting, like Pataswara Jilla, not in terms of service, but your Kamko Sirisala and stuff, But mostly we've taken your Sudra Pashchim, the Karnali district. So we've covered almost most of them. Karnali district, remote, So remote, it takes about 2 days to reach the place, 3 days of service because it's an operative camp. There's so many operations, eye operations, ENT operations, and so many things going on. then we come back, takes 2 days. Logistic is very difficult. And suppose if there is a husband and wife or a couple going in the trip, the logistics makes sure that we are not in the same vehicle or not in the same plane or not in the same transportation that they take us, because one person or one parent has to be back for the children.
That's true.
So it's so difficult. Yeah. So
when you are going like Bhagwan Bharosa.
yes, exactly. And then when when we come back, it was like कसरी गयो अब त
Next time to
yeah.
Vienna.
And then right after 1 week we are like, where's next, So that's
तर त्यो तपाईँले भन्नुभएको जस्तै त्यो रिमोट ठाउँमा गएर होइन एकदम दुःख पाइरहेको जनताहरूलाई सेवा गर्न पाउँदाखेरि
yes, for free we give medicine. Now that the local government पनि हाम्रो organizationलाई they've helped. They chip in, they do our logistic, our local त्यो बस्ने खाने, everything is taken care of. So it has now become a bit easy for us. Yeah.
So that means like you're producing lots of serotonin in your head.
Happiness.
Yeah. By परोपकार गरेर हैन.
So once a week we have this clinic where we go.
सबै डक्टर यस्तै हुन्छ.
हुन्छ जस्तो लाग्छ मलाई.
अरूलाई गएर सेवा गर्ने, रिमोट ठाउँमा गएर सेवा गर्ने कि कोही डक्टर खाली पैसा 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 भन्नेहरू पनि.
हैन, अब यसमा दुईटा छ. There are certain people who really want to help, who really want to cure. के भइरहेछ पत्ता लगाऊं, निको पारौं, let us ease the pain that they're in, but एउटा category. But it's very difficult now from our point of view when we ask people to go as volunteers. There is a certain strata in the society where they do ask for money. Per day कति दिनुहुन्छ? So that, we at times think back, because हाम्रो यो जुन team, so we're all friends, we're all of the same ideology. Giving back अथवा volunteerism भन्ने जुन concept लिएर we're there. Yeah, हाम्रो group छ. त्यो groupमा चाहिँ we think who's going to lead next, because there has to be a leader after a couple of years. हामी मात्रैले सधैँ गर्न मिल्दैन, but to getting to know or getting to find the next generation to lead has become a little bit difficult for us, okay? Because volunteerism has to come from inside. You can't force volunteerism into people who do not know the essence of, treating and giving back.
अनि त्यसको एक्सपेन्सेसहरु यिनीहरु चाहिँ कसले ह्यान्डल गर्छ?
So early हाम्रो कस्तो हुन्थ्यो भने we had this opinion of only asking donors from Nepal. So अहिले बिस्तारै we do get money from outside. तर there's a daughter at the table who sings and collects funds. So हामी सबैले, it's a collective effort. So साथीभाइलाई $100 देऊ न. So for them $100 is, I think, nothing. But for here it is 13,000 रुपैयाँ. So it can go to the pool. So one logistic हाम्रो एउटा गर्दाखेरि स्थानीय सरकारले हामीलाई हेल्प गर्दाखेरि पनि it comes around 30 lakhs per one visit of this हाम्रो team, transport, logistic, use of food, medicine भयो. We give it all free. We give it for free because medicine is sometimes so people just come for medicines because they do not know when the next cab or when they're going to see a doctor. So they hoard at times, And बाटोमा हामी फर्किँदाखेरि यहाँ आउनुस् doctor said, please tell us what this medicine is for so that we can know when to have it when we have what symptoms, So there are times when people just come to hoard medicine. There are genuine patients, and we don't leave them in that sudurpashim as such. We have a mechanism of getting them to, because I'm here, so a different hospital, so at least to get a cancer भयो, or suppose हामीले अब डर्माको हिसाबले कसैलाई leprosy भयो or TB पत्ता लगायौं skin को, So we make it such that they reach the nearest hospital and then get their supply of medicine and they get treated. Otherwise, leprosy, if we just leave it, diagnose it, that's अनि छोडेर आयो भने त त्यसको complications औँला झर्ने, so many things, and it's an infectious disease. So अरूलाई पनि त सर्छ नि त. So we make it a point that we follow them up also. Follow up नगरेर point prevalent camp गरेर पनि हाम्रो अनुसारमा चाहिँ doesn't matter जस्तो लाग्छ.
Okay, that's a great job. Thank you very much, Dr. Sas, for that wonderful voluntary services you're doing to the rural and our population, Nepal's population. So, our ISKCON company, we have like different social service wings. त्यसबाट पनि हजुरहरुलाई मद्दत गर्न सकिन्छ.
And we're also vice versa when you have any help that you need from us.
We have like also team of doctors. उहाँहरुले पनि यो क्याम्पहरु गरिराख्नुहुन्छ. भक्तिवेदान्त हस्पिटल क्लिनिक भनेर चाहिँ. They are doing lots of like camp. तर अब हजुरहरुले जस्तो अब पुरै त्यो रिमोट उसमा त जान सकेको छैन. So maybe next time भयो भने you can let us know. And some of our doctors may also join.
Yeah, that is.
Right? This is such a wonderful thing, right? Well, coming to subject matter, you being doctor, do you believe in spirituality or religion?
I do, but that also has to come from inside once in that quench, that thirst to seek into religion, to seek into spirituality has to come. There is always a time because पहिलेदेखि नै भन्ने पनि हुँदैन.
पहिलादेखि थिएन तपाईको.
थिएन. But still I think for me spiritualism is work. Okay, whatever मेरो लागि चाहिँ work साधना हो because the
how would you define it? I'm sorry.
Yeah, so like working. That gives me happiness. If that gives me the peace of mind, if that whole day मैले राम्रो काम गरेर, if I can go back to sleep with a content, that is spirituality for me.
Okay.
So
true. Very true.
Yeah. So for me, I think work overshadows, but I do read. I do have that quench. I do read books. I'm into the Zen book, my everyday one subject. So to be with myself, I do meditate. I do do the breathing and stuff. But for me, it's more of my work, which takes the upper hand.
मेरो पनि एकजना दाइ हुनुहुन्थ्यो. अहिले उहाँले बडी लिभ गर्नु भएन. हाम्रो डाक्टर रोशन श्रेष्ठ, उहाँ चाहिँ अर्थोपेडिक.
ए हजुर.
अनि हाम्रो यो के अरे यो प्रकृति मण्डपमा मोडल हस्पिटल होइन, काठमाडौँ मोडल हस्पिटलमा हुनुहुन्थ्यो. अनि म कहिले काहीँ जान्थेँ. अनि रोशन दाइ आउनुहोस् न, मन्दिर आउनुहोस् न. अनि मेरो मन्दिर यही भाउ हड्डी भाँचेर आएको हुन्छ, जोड्ने हो, खुसी पाएर घर पठाउने मेरो मन्दिर यही हो भन्थ्यो कि उहाँले पनि. Now that's like very true, very true. I mean, spirituality is there in your work. I mean, especially when you're serving.
Yes.
And जब तपाईले सेवा गर्नुहुन्छ, सेवा भावमा गर्नुहुन्छ, it's true. Right? And how about religion?
Religion, it's open for me because I studied in a Catholic school, so that thing of God is watching me, imbibe गरेछ, so that is always there for me because and that helps me in treating patients because God is watching me. Of religious, in terms of Hinduism, I do follow the different norms that has been set, but
all the rituals.
Yeah, mostly. But
and Bhagwan छ विश्वास लाग्छ?
I do. There is a higher source. Yeah, there is somebody who is guiding you.
How would you, or why would you believe that?
Because if
विश्वास लाग्छ,
because end of the day there is karma. I do believe in karma. I do believe in the karma concept because what you give is what you earn, and we never know whether there is a past life or there is, because that is not beyond, not in my journey. I've not had so much of experience to talk about it. But what I believe is the work and karma are my two things, because what you do is how you sow, how you reap.
Right.
Exactly.
त्यो पनि हो नि. अर्को maybe तपाईले एक्सपिरियन्स पनि गर्नुभयो होला हजुरकै प्रोफेसनमा पनि. The same medicine एउटा पेशेन्टलाई काम गर्छ, अर्कोलाई गर्दैन.
Oh.
किन?
I think that is how you counsel, because I spend a few times with the patient, however, because the schedule is packed. As a ma'am, also patients, so try to be fast. But for me, fast is not fast. If you ask my patients, they'll say, I talk to patients, I can, feel, or I can see the sorrow in their faces in patients who come. So if I just, talk to them, especially elder people who have nobody to talk to, then you can actually feel their pain, why they're doing so. So त्यसले पनि भन्छ नि डाक्टर कतिले भन्नुहुन्छ बोलीले पनि कति रोग त निको हुन्छ भन्छ. So that's, I think, if you just spend a few minutes, just one के छ बुवा सबै ठीक छ त, तपाईलाई अलिकति पीर परेछ, or आमा, that really matters. Yeah, that matters, and that makes them comply with the medicine also. यो डाक्टरले चाहिँ निको पारिदिन्छ भनेर भनेको छ, बोल्नु भएको छ मलाई. So compliance of taking the medicine. Otherwise, मन परेन भने पेपरलाई बाहिरै च्यातेर यहाँबाट हुँदैन. I've lived with the itching since so many years. चिलाइरहन्छ तर हुँदैन रहेछ. So त्यो पनि त thoughts आउन सक्छ नि त पेशेन्टमा, हैन?
I mean, मैले भन्न खोजेको चाहिँ के भन्दाखेरि डाक्टर साहबले त राम्रो बुझाउनु भयो हैन. यो अब रोग पनि भनेको हुन्छ हैन. सर्टन सिम्पटमहरु भयो यो रोग भनेर रोग पनि हामी क्याटेगोराइज गर्छौं र त्यो रोग पनि हामी पत्ता लगाउँछौं हैन. भनौं दुईजना पेशेन्ट छ, एउटै रोग लागेको छ, एउटै अमाउन्टमा त्यो उसको भनौं न इन्टेन्सिटी, त्यो डिजिजको इन्टेन्सिटी त्यति नै छ. अनि भनेपछि त यो रोगको लागि यो औषधि भन्ने हुन्छ. अनि यो औषधि दिँदा एउटाले निको हुने, अर्कोले नहुने. हैन, तपाईले त्यति नै माया गरेर दुईजनालाई गरेछ भने भनेपछि यो कर्मसँग
There-
रिलेटेड छैन होला है एउटालाई नै गाउने अर्कोलाई न
or there's त्यही हो higher power भने
है
somewhere somewhat something which
त्यस्तो
is
हुन्छ नि हैन
हुन्छ एकदमै हुन्छ कसैलाई त्यहीले हुन्छ कसैलाई किन भएन भनेर there is a point where I have to internal think हुनुपर्ने why is it not हैन there has been moments like that
है
yeah
त्यो बेलामा चाहिँ there is some divine
yes
some higher power
I know
हैन which is governing भने जस्तो
so मेरो examination tableमा there is a god हैन so
कसलाई राख्नु भएको छ
अहिले उहाँ goddess हुनुहुन्छ हैन so there is a god and you know how people perceive the patients perceive the god in different ways kids come because he has a hand like this high five god so they come so they come and give him a high five you know so they become so comfortable in the setting when they give a high five then they forget that they're inside a doctor's room otherwise के गरे हुन्छ हाम्रोमा त्यो खाएन भने डक्टरले सुई लगाइदिन्छ so that fear has been installed in many बच्चाहरुमा तिमीले यो गर्यो भने म डक्टरले त
मलाई चाहिँ बच्चालाई पुलिस भनेर तर्साउँछ अनि पछि म अलिकति एडल्ट भइसकेपछि त्यो पुलिस केही नगरे नि त्यो पुलिस देख्यो नि डर लाग्यो
so doctor पनि त्यही हो so I tell them see my hands you can touch my hand you can keep my hand in your hand I don't have a syringe so I'm not that doctor दिनै पर्ने भएर त it's for them but यसरी तर्साइदै हुन्छ कि खाएन भने पनि डक्टरले सुई गोर्छ and then there are त्यस्तो हुन्छ नि त हैन so त्यो हुन्छ and फेरि अर्को group of patients come then they try to you know relocate that god the god has to face this side of the room so god is constantly moving inside my table like in my different corners of my table north face गर्ने south east face गर्ने so एकजना कोही हुन्छ patient who comes they feel you know calm instantly because god is there I know I'll get treated so there are different versions of you know patients are पनि different
and if God exists really exists or not भन्ने क्वेशन एउटा ठाउँमा छ भने त्यसको जुन साइकोलोजिकल जुन
impact
छ इफेक्ट छ हैन त्यो इमिडिएटली त्यसको लागि भए पनि आई थिंक इट्स सच अ ब्युटिफुल कन्सेप्ट इजन्ट इट हजुरलाई लाइफको कुनै यस्तो मोमेन्ट छ जहाँ चाहिँ where you really prayed to God I mean
yeah because I've been through के भन्छ I've lost my brother I've lost my parents there has been times when
painful
when it has been painful but these are the times when praying gives you so much strength that सबैकोमा त छ mom ko recently it's been 6.5 months it was difficult but when you go back to work and patients relate मैले मेरो पनि त्यस्तो भएको थियो नि मेरो पनि यस्तो भएको थियो there was a time when patients would say you know मेरो she was a patient who was dealing with clay she would make hand figurine out of the clay and her mom used to call when her hands were so dirty inside the clay making a figurine and stuff so she would postpone and पछि call गर्छ and then that पछि didn't come and one day the mom called and then she had this in the phone and then she died so that problem उसले जुन relate गर्यो नि so at least you could be with her I couldn't because she was in a different country and अहिले चाहिँ even when my father rings up at any time I'm there so there has been but prayer and God and you know the belief really has been there to get me past through the pain that is there
तपाईले हामी जस्तो पुरै भगवानकोमै लागेको मान्छे देख्दाखेरि कस्तो फिल हुन्छ
positivity
के काम नपाएको जस्तो लाग्यो
no
I'm an engineer हैन तर सबै इन्जिनियरिङ यताउति भनौँ न प्र्याक्टिस छोडेर पुरै स्पिरिचुअलमा लागेको छ what a waste हुनु भन्छ
no not at all
you don't feel like
no I don't because there has to be someone to give you positivity there has to be someone who is there to you know has experienced what we have not or we're still in the path of the searching that is the
so अनि यो हजुरले भन्नुभएको जस्तै हैन हामीले मोडर्न मेडिसिनमा साइकिक हिलिङ त्यो दुईटै मिक्स गर्यो भने चाहिँ हजुरले भन्नुभएको जस्तै त्यो बिरामीलाई कसरी बेस्ट हैन छिटो क्योर गर्ने भन्ने किसिममा आउँछ त रोगै लाग्न नदिने भन्ने कुरा आउँछ नि हैन सो अनि यो चाहिँ कस्तो हुँदो रहेछ भने डक्टरहरुको चाहिँ अहिले मोडर्न मेडिसिन पढिरहेको डक्टरले आयुर्वेदिकलाई मान्दैन भन्दै अनि आयुर्वेदिक अथवा यिनीहरूले होमियोप्याथीलाई नमान्ने होमियोप्याथीले नेचुरोप्याथीलाई नमान्ने इट्स लाइक देयर इज कम्पिटिसन काइन्ड अफ थिङ के
अब त्यसलाई म कसरी लिन्छु भने नि होइन सो सिन्स वी आर लाइक मोर अफ एन एलोप्याथिक genre भनौँ न होइन त्यस्तोमा पनि देयर इज अ लट अफ कन्ट्रोभर्सी इफ इट वाज प्योर देयर इज नथिङ टु से अबाउट इट बट के गरिदिन्छ when the people or definitely most of the people in Nepal would rather go to for Ayurvedic treatment than coming to allopathy त्यो पनि छ एउटा पाटा होइन
कतिपय मान्छेहरू त्यस्तो
छ for pain for example simple example for pain in the joints तर त्यो आयुर्वेदिक मा if there was honesty they would not mix steroids and give it to the patient
That's true.
होइन
मैले यो पनि
so the steroid
painkiller.
yeah painkiller and steroid त्यसलाई पिसेर दिएको हुन्छ which is proven भनौँ न and what happens patient is भित्रबाट पनि अब मैले यो लिएपछि फाइदा हुन्छ भने that positivity or that thing is already छँदैछ and then when they take it definitely it becomes better for them निको भइहाल्छ so long term मा के गयो liver गयो kidney गयो so when you ask them के लिएको थियो त then you know औषधि
आयुर्वेदिक साइड इफेक्ट छैन भन्छ हैन
त्यही भएर but everything has to be written अब मेरो स्किनको केसमा भनौँ न चायापत्तो is with everyone आयुर्वेदिकले के गर्छ there is this cream लाउने बित्तिकै च्वाट्ट जान्छ there is 100% guarantee patients ask guarantee from us we cannot give guarantee because we do not know I tell them guarantee छ तपाईँ यहाँबाट घर पुग्ने you never know नि त हैन so उसले 100% guarantee दिएपछि the patient will definitely believe them and त्यहाँ केही खुलाएको छैन what is what inside it's just a plain हरियो रङको बट्टा or a पहेँलो रङको बट्टा it's just a colorful बट्टा and patients blindly buy it what is there is हाम्रोमा युज हुने steroid निचारेर राखेको there are evidence हैन त्यो लगाइदिएपछि के हुन्छ 14 days मा they become so झललल the thing goes they then 14 days पछि they start developing symptoms and then they stop गर्ने बित्तिकै it comes back with a bang
क्योर त भएको
छैन it's just temporary त्यो त्यसपछि they get into that addiction of using it not using it and long term side effects of steroid is like enormous भनौँ
even हड्डी पनि perforated हुन्छ भने
अनि गालामा त फालफाल यो सबै छालाहरू देखिने रौँ आउने घाउहरू आउने डन्डीफोरहरू आउने so many and then you ask them के लाउनु भएको थियो because we have a scope we have so many devices to detect that there has been some tampering with the skin and then they'll say no केही पनि लाएको छैन only एउटा आयुर्वेदिक so you know we are still in the battle of knowledge sharing to patients to tell them that absolute guarantee दिने क्रिमै हुँदैन चायापत्तोमा you need to know where is the pathology कसरी भइरहेछ what are the things that are aggravating कुन स्टेपमा हामीले कुन औषधिले चाहिँ त्यसलाई स्टप गर्ने so it's a very complex but they make it sound like it's जसले पनि गर्न सक्ने this and then this happens त्यो happen गरेपछि then there's no to get them back to the real or the pre-skin test it's very difficult and sometimes patient Steven Johnson भन्छ हाम्रो burn भए जस्तै हुन्छ कि जपाइते औषधि खाइदिन्छन् without any formulation then skin मा react गर्छ so skin सबै peel हुन्छ burn हैन so it's like putting the patient or patient having 80% 90% burn which is an emergency condition अब त्यसोलाई के गर्यो त when you have to take a history there's not a single allopathic drug that you can pinpoint but then घुमाउँदा there are these bhasmas which come into the play until they गरे हुन्छ so it's जति गर्दाखेरि पनि to put it into their mind or into their mindset that यो औषधिले गरे it's a challenge
what about like good ones ayurvedic ma good proper treatment
I do take it myself म पनि कतिवटा लिन्छु हैन खोकी लाग्यो so these are science backed up पनि त हुन्छ नि
हजुरले भन्नुभएको छ यो आयुर्वेदिकमा चाहिँ रेगुलेसनहरु भन्छ
हैन त्यसमा अब के छ because अब allopathy has randomized control trials भन्छ त्यसलाई हैन so RCTs भने चाहिँ करोडौं अरबौं मान्छेमा गरेर yes औषधि no औषधि and then गरेर so there are different clinical trials गरेर it comes into the market तर अब आयुर्वेदिकमा there still has a lot of research to be done science so Puriya system of the chiniको डल्लोमा so that is not backed up by science though it is a very पहिलादेखि गरेर आएको when allopathy was nowhere in the picture तर अहिले अलिकति चाहिँ त्यसमा sincerity and truth छैन कि control भएन right
भनेपछि डाक्टर साहबले पनि एलोप्याथी सँगै अरू नेचुरोप्याथी यिनीहरू चाहिँ सिकाउनुहुन्छ हजुरले पनि You're not against that.
No, I'm not against that.
And
But
I'm turmeric लगाएर skin राम्रो हुन्छ भने why should you?
त्यसलाई चाहिँ again I have a different version of telling patients because they randomized गरेछ and you've not tried putting turmeric in one half of the gala cheek and not putting and then seeing results over a period of time. Yeah, over a period of time in X number of patients. Especially efficacy of turmeric. But turmeric is a very vitamin A derivative. I mean, it's a vitamin A has so many research-based backup that yes, it does have effects on the skin in so many different levels.
Vitamin A र E हो के skin.
So A को derivative in so many different diseases from right from starting acne to anti-aging, so many things. तर अब so तिनीहरूको precursor भयो काँचो बेसार चपाउनेदेखि लिएर and काँचो बेसार दल्ने or something. But for melasma, if you put a paste and then scrub it, you just do a temporary treatment of taking the skin off. You're not treating the cause. Okay? त्यस्तो हुन्छ different aspects here.
त्यो मेलाजमाहरू भयो यिनीहरू अर्को यो फंगस हैन यिनीहरूको चाहिँ इट्स भेरी ट्रु र फेरि के मुन्डामा त भिन्न हुन्छ नि हैन फेरि डाक्टर जतिवटा टाउको त्यतिवटा विचार हुने जस्तै डाक्टर पछि ट्रिटमेन्टहरु पनि फरक हुन्छ
but that all depends upon the experience and the molecules because it's a subject which is evolving. अब मैले पहिला पढेको जुन कुरा छ now my students are my teachers. I learned from them because it's an evolving process. Okay? Certain things they are expert at. Procedures bio.
They're more information.
Yes, so they are like so much well read. I'm not saying it's experience. I'm saying back to the answer, forward of the answer. So now I take my advice from my students because they're more well versed, more up to date than me. Role play change. So
अहिले फेरि एकदम मोडर्न मशीन्सहरु आइराछ हैन लेजर के भनेर how better are they? I mean,
yeah, म त के भन्छु भने given resource छ भने because they don't come cheap. But they're all for cosmetic benefits. There are times when these lasers are used for medical purpose. Suppose a simple example मैले दिए भने hirsutism or hair at unwanted sites. केटी मान्छेलाई केटाको जस्तो hair आयो
अथवा जुङ्गादारी
आयो. So that has a lot of psychological impact on the young girl. हैन जानु भएन कोएडमा पढ्नु पर्यो भने that जुङ्गादारी has to be taken care of every day. She'll get bullied.
Yeah.
So many different impacts. Shall बाहिर निस्किन society-मा face गर्न. So there's so many different aspects of that एउटा hairले does on the patient's psyche or the patient's body.
जब एउटा रौँको पावर.
So त्यसको लागि निकाल्नलाई laser बनाइदिएछ laser hair reduction. So that when you use it, it's so much, then she gets her confidence back. Then she gets her, she's ready to face the world. She's a different person, Teachers are like, when I'm teaching, I feel the students are, focusing on my jungadari, on the hair that is coming out. They're not listening to me. Just once again, teachers are like, and then they're so ready. So that is what one part of the for treatment, which is causing psychological distress to the patient, or could say for cosmetic purpose because if they want a clear skin, राम्रो हुनु पर्यो because yeah, so त्यो वाला छ. So they have their wounds.
So हजुरका आउने पेशेन्टहरु maximum diseaseबाट आउँछ के यस्तै
होइन म चाहिँ अब clinical because I've been a professor now I'm like more into clinical practice भनौँ हैन. So I'm like एकदमै disease oriented. I am very particular or very selective on the cosmetic portion that I do, but I'm like more into रोग पत्ता लाऊ रोग निको पारौँ because skin चाहिँ it's a mirror of what is happening inside. It's the largest organ of the body. And भित्र everything को जुन organ को dysfunction चाहिँ skin मा देखिन्छ. So my expertise is to look into what is happening holistically once, okay? Skin लाई मात्रै mai.
हजुर सर. अब अलिकति स्पिरिचुअलिटीसँग जोड्नुलाई हैन. It's like what you call glow.
Yes.
हैन हामी भन्छौँ नि हामी एकदम भाइब्रेन्ट हुने एकदम ग्लो अरा निस्किने भन्छ नि हाम्रो हैन अनि त्यो अरा ग्लो चाहिँ हाम्रो जनरली स्किनबाटै आउँछ. अब भित्रको अर्ग्यानले त गर्न सक्दैन बाहिरदेखि त स्किन हो हैन. भनेपछि यसमा स्किनको ग्लो हुनुमा माइन्डको कतिको खेल हुन्छ मनस्थितिको.
त्यो त म एकदमै I couldn't agree more. I want to. Unless you're happy, unless you're content, the glow will not come.
Right.
Money is not going to buy you. Money can buy you, yes.
अथवा क्रीम श्रीमहरुले
cream, एकदमै महँगो cream, branded cream, but that's not going to give you the glow as what it comes from within. Okay? So you have to be, it shows on the face. कोही मान्छेलाई ठस्स परेर रिस उठेर भने it shows on the face. Until no matter what you throw, देखिहाल्छ. That अँध्यारो देखिहाल्छ. But if you're happy, if you like, it's a vibe नि त. If there's so much of energy.
Sorry, हाम्रो नेपाली भन्दा नि यत्रो अनुहार
कति
त्यो साइज सानो भए त होइन तर त्यो feelings
yeah.
glow.
So it has to, it shows. त्यो त म एकदम मान्छु. I've been telling in so many different.
So when I see, if we practice spirituality, as if you become like happy from within, the skin ma glow.
So that's why you're so glowing.
Coming.
I'm sure you're not using too many.
No, nothing.
Yeah. But your face is like it's so much of aura and so much of glow. So that's coming from inside, from being with God, from being spiritual and religious. So it's an interplay, okay? So it's not only the creams that make you glow.
Right? That's true. So those have like advice गर्नुहुन्छ मान्छेहरुलाई. I mean, along with the clinical treatment, you also have to learn spirituality, like meditation and all this kind of thing.
So I always try to give them this holistic approach to treatment. So you should be happy. A weight घटाउनको लागि, whatever amount of exercise and take, if you're not disciplined in your eating habits, you're not going to lose weight. And with the weight, there are so many skin diseases which comes.
Ani overweight.
Yeah. So so weight maintain गर्नु पर्यो or ideal weight मा घटाउनलाई, there's so much of pressure and you can't achieve your ideal weight overnight. You have to work on it. To work on it, like सानो यो 20-30 वर्षको बच्चाहरुलाई छोरा उनीहरुलाई lose weight, come back. It's so easy. But from the patient's perspective, to lose weight and to get rid of the acne, to get rid of the unwanted hair, to grow the hair back where you're losing, where you want it more, it's so much of psychological aspect. Or even it has to be a multi-sectoral approach. Okay, because these kids, I've done a few psychological research on acne patients, school-going children. They will not come out of their room unless the acne is treated, because हाम्रो समाजमा के छ, everyone is a doctor. Hi, hello. Hi, hello. They're going to comment on the weight. They're going to comment on the face. Now, so that is the first. Yeah, so that is the first. And then that thing pulls your young growing mind. हाम्रो पालीमा चाहिँ acne भनेको, it's an adolescent thing. It's going to go on its own. Why put so many creams, or why even consult a doctor? Because this is going to go off once you become 20, 30, some n number of age. But now, with so much of media exposure, you can't afford to have acne on the face.
They cannot wait for the time.
Yes. So I tell them two things. For acne treatment, one, you need patience. Magic doesn't happen overnight. And the second is compliance. You have to follow my advice. Then in 2 months, 3 months, the same people who have been after you are going to come back and give you compliments. And then you'll remember.
That's true. मेरो पनि यहाँ पहिला निधारमा आउँथ्यो धेरै, हजारौँ आउँथ्यो, हजारौँ, सयौँ भनौँ न, हजारौँ डाला सयौँ. ओहो, टेन्सन हुन्थ्यो मलाई त. अनि कति क्रिम लगाएँ, हुँदैन हैन. अनि त्यसपछि later on somebody said blood purifier खाऊ, मेरो blood force छ भने खाए त केही मात्रामा कम भयो. केही मात्रामा चाहिँ कम भयो, त्यो कम्प्लिटली गएन. अनि आफ्टर सर्टेन इयर्स भनौँ न 25-26 भइसकेपछि आफै गयो कि. डाक्टर साहबले भन्नु एक्ज्याक्ट, आई मिन टाइमसँग जान्छ.
तर अहिलेको बच्चाबच्चीले they will not wait for time. It has such a lot of psychological impact on their well-being कि it's better to get them treatment.
भन्नु मतलब अहिलेको जेनेरेसन more external भएको भन्दा मिल्छ.
त्यही पनि होला. हामी त्यो बेलामा, maybe since I was into dermatology, I had a sunscreen. I had to apply it because I knew about the benefits of applying sunscreen on the skin. अहिले त they would come with one poka full of cosmetics. And I will think like, I'm a Zulu. Yeah. So you don't earn for it. And then I'm a ke भन्नुहुन्छ, see, she's bought so many. तर उसको त पैसा छैन. You're giving it to her. That you can't blame it because there's so many media influence in you allow to make everything. Yeah, so everything is about external beauty.
External beauty. Right. So that's how you're like someone who is like helping people to become beautiful and look good on the skin. प्याकेजिङ हो नि त यो राम्रो भएपछि झट्ट मान्छेले इमिडिएटली हेर्दाखेरि चाहिँ राम्रो भएको देख्छ होइन अब भित्र पनि राम्रो हुनु कतिको जरुरी छ
एकदम सेम कुरा हो भित्र राम्रो नभइकन बाहिर राम्रो हुँदै हुँदैन क्रिम लाएर त भित्र चाहिँ एकदम नराम्रो रिस राग एन्ड अरूलाई कसरी लडाउँ चढाउँ छल कपट अल दिज भाइसेस भनौँ न सो मेनी लिस्ट गर्यो भने बट इफ युर कभर इनसाइड सो मेनी भाइसेस छ भने द भर्च्यु विल नेभर सो
Wow. So skin is completely भनौँ न हाम्रो surface which is seen by the world तर त्यो स्किन सँगै हाम्रो भित्र पनि हैन भित्र भनेर त्यो यो के भन्छ इन्टर्नल अर्गनबाट मतलब सेल्फ इन्डिभिजुअल अथवा पर्सनालिटी पनि ब्युटिफुल हुनु पर्यो
You have to be first you have to be happy to make other people happy
है
yeah
र अहिले त्यो स्किन मात्रै हेरेर पार्टनर चुज गर्ने बिहा गर्ने मान्छेहरु धोका खान्छ नि है
so much of thing is into the external beauty अहिले बजार गयो डिपार्टमेन्टल स्टोरको आयल गयो cosmetic you're like mesmerized and then you go by packaging you go by smell and it's so many things to attract the young to attract
do it
yeah so अब you can see over the period of time हाम्रो पालीमा बनाउने पाउने कुराहरू त्यो evolve they become more creative अब अहिलेको generation is so creative अहिले त eyes see it first खाना पनि त्यही हो if the eyes see it first and the khana becomes mitho ni ta if you don't like what is there in the plate you're not going to eat it so if you're not liking what is there in the packaging you're not going to buy it so everything is consumer driven everything is it has to be beautiful in a package
so you have family and you have children
yeah I have two sons
are they spiritual
like that's how I know
right so what are they doing now
so one my eldest is pursuing film studies yeah and Sano has just finished his A levels and is plans keep on changing sometimes he wants to be this but whatever they take they need to be happy they need to be perfect in whatever field that they choose and content and happy because unless you're happy you cannot perform well you cannot get the best out of oneself because if I'm not happy in what I'm doing I will not be content I cannot treat the patient and I cannot bring the smile on the faces of patients and I can't have them coming back again and again I tell them abba bye bye hey abba please don't unless you want to meet me as a person not as a doctor so you have
मैले चाहिँ हजुरको छोराहरूको बारेमा किन सोधेको भन्दाखेरि एउटा डाक्टर भनेको आई थिंक एकदम बिजी मान्छे हैन प्रोफेसन वाइज एकदम बिजी मान्छे अनि त्यसमाथि तपाईं इन अ फिमेल बडी हैन अनि त्यो भइसकेपछि छोराहरूलाई कसरी अपब्रिङिङ गर्नुभएको छ भन्ने सोध्न खोजेको म चाहिँ
सो उनीहरूलाई अब टाइमिङको यहाँले भने जस्तै हो हैन तर अब दे ह्याड द सिब्लिङ्स वेयर लाइक अराउन्ड अबाउट 22 months difference so they had them the siblings more than साथीहरु जस्तो भयो to share अनि अहिले चाहिँ बिचारा त्यो सानोलाई कति गाह्रो भएको छ in terms of because it's been just 5 months that he's gone to Europe to study so he's not around so he's in so we try to at least understand him that it's a difficult job both of us being doctors and both of us being
you mean husband is also a doctor he's a tatana
but he is more spiritual and he is more
उहाँको चाहिँ केमा स्पेशल
उहाँको चाहिँ chest pulmonology and sleep medicine but his is like more thirst for spiritualism than me so for me it's like work but he is like more into so he reads a lot yes
okay so मतलब उहाँबाट भाइबाट आउँछ होला नि
त्यही होला
हैन
yeah
so you're lucky I mean when you जब श्रीमान spiritual हुन्छ नि such a like a safe हैन it's a safe combination एउटा केटाको एउटा फ्यामिलीमा चाहिँ एकदम ठुलो रेस्पोन्सिबिलिटी हुन्छ
what I keep telling him you need to apart from being spiritual you need to have that knack of identifying people who are not your type or people who are not good he thinks everyone is good
no त्यो चाहिँ होइन everyone is not good and of course like spiritually के हुन्छ नि hate the sin not the sinner हैन पापलाई घृणा गर पापीलाई होइन हुन्छ किन पापीले पाप छोड्यो भने त उ त सद्य भइहाल्यो हैन सो तर एट द मोमेन्ट कुनै मान्छे चाहिँ नराम्रो छ भने उसलाई त्यही अनुसारको ट्रिटमेन्ट हुनुपर्छ
or छोडिदिनुपर्छ you can't
avoid
Yeah.
and सक्बर उसलाई सुधार्नु पर्यो सक्दैन भने अभोइड गर्ने
सुधार्ने त होइन अभोइडै बेटर होला हाम्रो why go into यो फेरि एनर्जी लस तर उसले चिन्दैन मान्छे चाहिँ so for him everyone is
so that means it's too good
अब so I have to tell him that you say I can pick out people through there is something called your vibration there is something called energy थाहा हुन्छ तर त्यो उसलाई त्यति भए पनि
maybe you can meet with your husband then maybe I can tell him how to
so he's so looking forward to meeting you so HOT maybe
we can even sit and have a talk
yeah so I think next time I can
like it's such a wonderful thing I mean doctor and spiritual like I mean these are two जस्तै मेरो engineering र spirituality आउँदाखेरि there is science and spirituality कुरा आउँछ नि so I mean doctor is the same thing less technical but then more biological
so it'll be a good combo for the show
such a nice to know that and the best part is like doctor जो चाहिँ spiritual भन्दाखेरि धार्मिक भने हैन है स्पिरिचुअल भनेको साँच्चै जो चाहिँ भित्रदेखि एउटा ह्याप्पिनेसको कुरा गर्नुहुन्छ जो चाहिँ साइकोलोजिकल चिजहरुको कुरा गर्नुहुन्छ हैन अनि गाउँ गाउँमा गएर भलन्टियरी गर्ने कुरा गर्नुहुन्छ दिस इज रेयर तपाईलाई थाहा छ यु आर अ रेयर स्पीसिस
I think everyone is like that.
No, I've met like many doctors and doctors they are not like especially अहिलेको नयाँ पिढीको डक्टरहरु त they are all about money. They are after money.
Investment पनि huge छ.
हो. उनीहरुको स्ट्रेस लेभल कम्पिटिसन देखि लिएर सबै चीजले उनीहरुलाई कठोर बनाएको. सुरुमा चाहिँ त्यो पढ्छु भनेर जाँदाखेरि सबैको सेवा भावना नै हुँदै रहेछ. तर त्यो सिचुएसन एन्भायरनमेन्टले नै त्यो अहिले त के भन्छ इन्डस्ट्री नै भइसक्यो इट्स लाइक मोर ओभर लाइक अ सर्भिस इन्डस्ट्री नै कमर्सियलाइज
टर्नओभर पनि हाई छ देन गेटिङ इन्टु अ जब इज अल्सो अब हामीहरूले चाहिँ वी पढाउँ लेट्स गेट देम जाँछौँ बिकज वी स्टडीड इन अ प्लेस वेयर देयर वाज सो मेनी पेसेन्ट्स सो हात छामेर त्यो नारी छामेर थाहा हुने डाक्टर हुन्थ्यो नि त्यस्तो टाइपको के होइन सो फेस हेरेरै आई क्यान मेक आउट सो मेनी डिजिज उसको भित्रको गर्छु द्याट्स वाइ आई ट्राई टु टक टु पेसेन्ट्स हुम आई नो द्याट दे आर नट ह्याप्पी इनसाइड होइन मेरो सब्जेक्ट होइन जस्ट वान सानो वर्ड एन्ड दे क्राई अथवा आई क्यान अलवेज च्यानलाइज देम टेल देम तपाईँलाई अब यताउता जानु पऱ्यो होइन बट जस्ट सिक एकचोटि एउटा सेसनमा स्टक ओभर इट सम वान टु लिसन टु उहाँहरूले पनि धेरै गाइड गर्नुहुन्छ बिकज मेरो सब्जेक्ट म्याटर त्यो भएन बिकज एउटा सब्जेक्ट एउटा मात्रै के भने पनि आइभ सिन सो मेनी पेसेन्ट्स क्राई के त्यो हुन्छ नि भित्रैबाट छुने हो सो त्यस्तो तर अब अहिले त्यो बेलामा त्यही भएर मोर अफ क्लिनिकल एक्युपेन हुन्छ नि थाहा हुने अब अहिले मोर अफ अब यही यो कन्ज्युमर ड्रिभन पनि भयो प्लस लिगल इस्युजहरू पनि आयो सो मोर अफ इन्भेस्टिगेटिभमा गयो के इफ यु डु नट इन्भेस्टिगेट देन यो किन गरेन भनेर फेरि न्याक दिन्छ भनेपछि इन्भेस्टिगेटिभ आफ्नो क्लिनिकल एक्युमेन्टले गरेर गर्ने कुरालाई ब्याक सपोर्ट गर्नलाई इन्भेस्टिगेसन चाहियो हाम्रो पालिमा त वेन वी वर टट ओर वेन वी रेड इन्टु मेडिकल स्कुल हामी एउटा एक्सरे देखाएको थियौँ होला मेबी एन अल्ट्रासाउन्ड सिटी एमआरआई भन्ने कुरा त हाम्रो पालिमा थिँदै थिएन त्यो त हामीले यसो सुनेर अन्दाजको भरमा सिम्पटम्स सुनेर टाइम स्पेन्ड गरेर हिस्ट्री लिएर थाहा पाउने कुरा लक्षणबाट अब अहिले टक्क गयो यहाँ यो छ भनेर थाहा भइहाल्छ becomes easier. So there's both different aspects of treating patients now.
So भनेपछि पहिला चाहिँ तपाईको गुड इन्टेन्सन हैन तपाईको हुन्छ र यो बिरामीलाई कसरी निको गर्ने हुन्छ भने अहिले चाहिँ मोर ओभर लाइक वी आर डिपेन्डेन्ट अन रिसर्चेस डायग्नोसिस मसिन्स
सेफ
पनि इन्टेन्सन डजन्ट आई डोन्ट थिंक तपाईको राम्रो तपाईले भन्नु न त्यो पेशेन्टमा त्यो लक्षण हेरेर थाहा पाइसक्यो यो मान्छेलाई यो रोग लाग्छ भनेर तर अनलेस एन्ड अन्टिल यु डु ऑल दिस टेस्ट्स हैन यु आर इन रिस्क
So you can't verify अहिलेको legal status मा. खै त त्यो किन नगरे? They will not I cannot be safe by saying मेरो मनले मान्यो or I could see it with my eyes. That is not a supportive evidence for me in terms of legal issue. It has to be. Oh नि त this is what is happening. यो सबै evolve भइरातो हो नि. So यो फोनकै कुरा पहिला हेलो मात्रै गरेर अरु के बज्दैन थियो. अब now see the information on the phone. रोक्ने अब त्यो time गइरा हुन्छ but we can't keep the phone so much of information and your life is not private anymore. हामी कुरा गर्छौं and then it's already picked up by the phone. अहिले फोन खोल्ने बित्तिकै हजुरको आइसक्छ मका. हैन?
हामी अब दिल्ली जाने हैन उनीहरु कुराहरु नि त्यहाँ cheap flight दिल्ली भनेर.
Exactly.
है?
So it's not a private life anymore.
That's true. So we've been watched.
Yes.
पहिला माथिबाट watch गर्दै अनि
God
त्यहाँबाट
is watching us.
तलबाट उसको It's true, yeah. So it's really, really nice talking to you, Doctor.
Same.
It was like a wonderful thing. And I'm sure like I'd love to meet your husband. Doctor, spiritual doctor.
Yes. So we could talk and we could set up a date.
Definitely. Thank you very much for coming.
Welcome. Thank you.
So,
Thank
Hare
you so
Krishna.
much. Hare Krishna.